Nurses of Reddit, what's your worst work-related story? Had a nice older gentleman patient who was tachycardic, but all his labs were normal. He seemed like he took fairly good care of himself, was a little disheveled but he dressed nice and had nice shoes. We initially couldn't find anything wrong with him, but he had a peculiar odor to him that seasoned nurses would get suspicious of. I asked him if he had any infections on his body that he knew of, and he said no, but I wanted to do a thorough check, so we took off all his clothes, and he was fine, until I got down to his feet. He was wearing an old pair of socks, and as I peeled them down, literally the skin around his foot came off with the sock. I was essentially degloving his foot. It was so vile, I couldn't even get down more than a couple inches. It was raw flesh under those socks. The wound odor was so strong, I knew then that his feet were the source. He probably hadn't changed his socks in several months. He ended up being admitted and given lots of antibiotics and wound care. The memory of pulling down his socks will haunt me forever. 35-weeker delivered addicted to H and Xanax. Mom also stated she drank a fifth of tequila a day nearly every day of the pregnancy. Third baby delivered in 2 years like this. Tremors so bad from withdrawal she looked like she was having seizures. Their poop in the first few days of life is so acidic from everything in their system that it eats their bottoms. Terrible skin breakdown. Projectile vomiting. Inconsolable high-pitched neuro cry. Ugh. She's my sweet lil honey and I'm gonna take her home to foster if I can. Not a nurse but a nursing assistant. I was pulled to the ER one night to help with a patient being brought in by ambulance. We're a small hospital with only one nurse. Anyway, we knew this patient was going to be a mess after hearing from the medics that she had been on her floor for weeks. Her husband, who didn't live with her, had been bringing her food but otherwise left her laying there. The medics had to literally scrape her off the floor with the help of a shovel. She was a rather large lady, and you can't imagine the sores on her backside from laying there in her own filth for a month. We of course started cleaning her up right away, and it shocked me all the trash I pulled out of her folds. She even had a pop bottle lid in one fold that had carved a wound in her skin. Lady with sores and foul smelling discharge coming from her vag. We spent days trying to figure out what had happened. Lab sent, no infections, swabs clear. It was an enigma, until I caught her douching her vag with bleach. She thought that's how you kept it clean. Sex education is important, guys. I have a few that aren't the worst out there but they're still good times. A schizophrenic homeless man told me how he had to smoke all of the crack before the crack mamas could so that he can save the crack mamas' babies. Then there was the old man that would poop himself, dig his fingers in his butt, then proceed to put his poopy fingers in his mouth and up his nose. Lastly, was the obese woman that had horrible lymphedema, which made it hard for her to walk, so instead of getting up to the bathroom or commode she would ask for a towel to stuff between her legs and pee all over herself. The smell of that woman's inner legs cannot be described with words. Tough to choose honestly. A couple years ago I took care of a long haul trucker who developed a wound on the underside of his bowel sac. The vibration of the truck seat wore away at his scrotum, and he developed an infected ulcer. As you can imagine, this makes for a very fragile situation. One day we were helping him out of bed when his scrotum ruptured wide open. Pus splattered everywhere, and his testicles flopped out. A bad day for all involved. Also worth a mention, I've seen multiple patients come in with maggots in their festering wounds. How does a maggot infestation in your body go unnoticed? And for fun, the one time I had a patient fresh out of open heart surgery try to escape through the toilet. He was having DTs and withdrawals from a variety of street drugs. Found him knee deep in the toilet trying to swim out because he loves the smack. 4 security guards couldn't hold him, even with chest tubes, mid-sternal incision, Foley, the whole works. Don't do drugs, kids, but if you do, please tell us which ones. My best friend is an RN and her favorite story is about a super nice lady in her late 30s who came in because of a labial abscess. Basically she got an ingrown hair from shaving, which got infected and resulted in most, if not all, I can't remember, of her labia needing to be removed. But why stop there, right? Turns out, the tissue just did not want to heal. She was in the hospital for nearly a month while they continued to IND farther and farther up this poor woman's abdomen until she basically had no flesh from the belly button down to her lady bits. It did finally start to heal, but holy frick, man. elderly addicted prostitute admitted for sepsis yet again. Cultures are all negative until someone sees that her colostomy is a bit too red and puffy to be considered normal. We cultured it and she had syphilis as well as a bunch of MRSA. Turns out she was letting some of her Johns frick her stoma. When we told her what we had figured out, she just shrugged and said that a hole is a hole. Things I've helped remove from grown men's dong: Lego lightsaber, baby carrot, plastic spoon, small circular magnets, purple crayon, golf pencil, and I've only been in emergency medicine for 6 years. I work as a nurse in a cath lab. Once was on call when we got a patient with a massive heart attack. No chance of a sinus rhythm so far, and he was incredibly hard to resuscitate because he had had a coronary bypass and the bones in his chest were fused together like a knight's armor. This was a comparatively young man in my line of work, mid-50s I guess. He died in our cath lab. Anyways, turns out he had a very heated argument with his grown-up son that night when he collapsed and had his heart attack. Apparently, a couple of days later his son hung himself in the woods near where they lived. So many dead kids. No matter how gross something I see is, and there are plenty of gross things I have seen, or the trauma I see in adult experience, or the car accidents I saw as a paramedic, or the loss I see when the family comes in when a PT dies. As long as a kid doesn't die when I'm at work, it's a good day. The worst I have seen is either the kid that was starved to death by her parents or the kid who was shot in the head in front of the rest of her brothers and sister by her father after she threatened to tell the cops about him groping her. I decay about worst, but I'm at work right now and a few hours ago I asked a patient for a urine sample and was punched in the throat. Thankfully it's gotten better since then. To be honest, the real worst stories most nurses don't like to talk about, but here is a pretty awful case that is definitely up there in the category of unfortunate souls. This poor lady we had who was constantly coming in with sepsis, blood infection. She had abdominal surgery and developed a fistula, which is basically a hole where there shouldn't be one. Basically, the first one that happened was because her intestines stuck together and a hole formed through the walls of them. Every time they tried to fix them, she developed more. She had holes throughout her intestines, so she had a colostomy bag. But she also had developed numerous fistulas all over her abdomen from where her intestines had stuck to the inside wall of her abdomen and formed holes all the way through her skin. So she basically had a bunch of holes all over her abdomen that just leaked stool everywhere. We had an extensive abdominal dressing regimen, where we actually put colostomy bags over a lot of the holes. The whole deal took 2 nurses about an hour to an hour and a half, and no one wanted her twice because she was really needy, whiny, and mean. Plus she was on MRSA precautions, so you had to gown up every time you went into her room. We changed her dressing 2-3 times per shift because no matter how well you did it, stool would leak onto her fragile skin and erode it further. It was awful, and even though she was a really difficult patient, we obviously felt bad for her. There are so many to choose from, but here are a couple, which are actually quite sad as well. 1. A lady who lived by herself had fainted on her patio and no one found her until 3 days later. She had been lying in her own feces, and when she came into hospital we found live maggots crawling inside her vag, and she was septic. 2. We had a very obese and diabetic lady, 250 kg, who was only in her 50s, admitted with infected necrotic wounds on her apron. Unfortunately she had left it for so long that the only option left for her was surgery. However, surgeons deemed her unsuitable for surgery. She eventually passed away, but what was so eye-opening to me was that we had to order a specific body bag for her because she couldn't fit into a normal one. It took 2 wardsmen and 5 nurses to get her into a body bag. Did a short stint in mental health. Had an 18-ish-year-old come in. Had been found in the fetal position covered in crap and naked in her bedroom by police. She'd basically been locked in there by her parents for years, most of her life. She kept asking for her mum cause she didn't know how to do anything. Her mother was still trying to control her from prison. 20-year-old patient in 4 motorcycle accidents on helmet. Kid survived but was never going to be not a vegetable living off of 15 different tubes ever again. He literally lost too much brain tissue. That kinda stuff is par for the course in a level 1 trauma center. What was hard was watching his parents stay in his room in shifts, documenting every little twitch and spasm and reporting it to us as a sign that he was waking up, only to have to be gently told, after assessing of course, that it's just spasms with no conscious thought. They would also happily keep telling us about the welcome home party they had planned for him, and making jokes that they're never letting him buy a bike again. One day they started visiting less and less, and eventually stopped coming at all. Finally, they made him a DNR. He was their only child. Dang. My mother-in-law is a nurse, and every year around Christmas there is a man who comes in with a candle stuck up his bum that progressively gets bigger. Last year she compared the candle to the size of a pickle jar. Eventually that guy will get his wife a big enough candle. Too many to choose from, so I'll just go with a recent one. Was doing wound care on a diabetic man who took zero care of himself. It was a foot ulcer with necrotic tissue and gangrene. Awesome. As I was pulling the old dressing off, I felt a subtle crunch. I looked and saw that the dressing pulled one of the man's necrotic toes completely off with it. The heck of it is? He just sighed and said not again. Turns out just a few months ago, his other foot was at that level of ulceration, and one of those toes came off when he went to put shoes on. How he failed to notice the smell and severity, although TBH he was morbidly obese and couldn't even see his feet, is a mystery. So many to choose from. I'm gonna go with the homeless guy that came to our hospital with an abdominal abscess, basically a hole in his abdomen. We were trying to clean his wound and assess the damage, and when we reached inside his wound, we started finding money. He nonchalantly stated that he kept his money tucked in there to protect it from being stolen. I'm not a nurse, but my grandmother was. She was a nurse, and while working the night shift they had a guy come in on an ambulance after being in a serious motorcycle accident. He was holding his helmet by the plastic face guard and the EMTs couldn't pry it out of his hands. The guy was in such bad shape they didn't have time to waste, so they brought him to the emergency room. When my grandmother and several other nurses tried to get the helmet away from him, he bashed her in the face and knocked out 75% of her teeth. My grandmother had a full set of dentures from age 24 on. Not a nurse but a medical assistant. Was my first day on the job at an urgent care and was asked to assist with an abscess drainage. I said sure. Walk into the room. The patient is laying on the bed with her legs in stirrups. No big deal. Just assumed the abscess was on her inner thigh maybe. Wrong. She had two abscesses. One on each side of her labia, each about the size of dates. So the doctor cuts into the first one. Now usually with abscesses, you cut it open and blood and pus drains out. This one though, she cut it open and a green fluid the consistency of molasses started to leak out. The smell was so terrible, but I could not react as the patient could see my face and I did not want to embarrass her any more so than she already was having vaginal abscesses drained and all. When the draining slowed down, the doctor literally started pulling on it, basically roping it out of the wound. After packing the drained abscesses I had to bandage her up. After the patient left I was congratulated by my co-workers for keeping composure, especially for it having been the first procedure on my first day. I was in nursing school and did hospital placement this past year and saw a couple things that were interesting. A teenage girl came in after she stabbed herself in the genitals with paper clips to the point they had to be surgically removed was probably one of the most memorable for me. The other memorable case was a pedophile that was found wandering around with advanced dementia and brought to hospital. He had to have one-on-one care all the time because he kept harassing the nurses and at times thought he was in prison and would get violent. A 13-year-old boy once ejaculated on my arm in front of his grandmother. He was in the ER for a boil near the base of his dong. Went to do wound care. Didn't even touch the dong itself. Barely had started and then splodge. All over my freaking ARM. Not a nurse but I work in the emergency department. PT came in and said he hadn't pooped for a week. The doc prescribes some stool softeners and decides to send him home, without ensuring that he had a bowel movement before he left. PT comes back in 6 hours later and is having severe abdominal pains and is brought in one more time. PT is put on a bed and scheduled for some type of scan. All of a sudden starts feeling nauseated. PT then starts literally throwing up his feces. He was obstructed. The nurse and attending run into the room. Nurse pushing on the stomach and attending holding his back trying to get the rest out. PT aspirated and had a heart attack. The shittiest way to go. The worst smelling thing was a homeless man who came in with what looked like moon boots on his feet, except they were surgical boots that he placed foam around and duct tape. They hadn't been removed for about 3 months. He was also diabetic and had ulcers on his feet. We had to cut them off to be able to see what was happening. The smell permeated the entire emergency room. To top it off, maggots were just falling off his feet and wiggling on the ground. He was yelling down the hall and rude to everyone but me and would only let me take care of him. He ended up refusing care and insisted that we tape his shoes back on and let him leave. Management finally said we could and we sent him off. Saddest stories are the kids. 6-year-old shot by a drive-by and was being coded by the time she arrived. She didn't make it, and hearing the mother hear the news and screaming from down the hall will stick with me forever. I'll go with a sad one. 32 years old male had bad motorcycle accident and was in our trauma ICU for over a month. Barely made it and was somewhat miraculous. He ended up with a tracheostomy but was on his way to being able to discharge to rehab. I had taken care of him 3 days in a row, and the last day, late in the shift, he stood up and coughed really hard. We were getting him back to bed from the chair, and all of a sudden blood starting spurting out of his trach. We got him in bed quick, and within a minute or so he starts coding. Cardiac arrest. We call for trauma and end surgeons and start mass transfusing blood while coding him. Family screaming and being escorted out. Slipping on blood on the floor while we were trying to keep coding. Holding pressure on his neck because we didn't know what else to do. One nurse says she thinks he stopped bleeding. He did, because he fully exsanguinated, bled out. We finally called it after about 45 minutes. He had a tracheoarterial fistula which burst. Artery around the trach that was worn down by the pressure inside the trach cuff. From a combination of persistent hypertension and strong cough and crap luck. This happens in 0.7% of all trachs. Nurses were sitting on the floor crying, and same with the MDs. It was a crap night and a crap couple weeks following. Labor nurse here, 36-year-old female patient who had been diagnosed with stage 4 ovarian cancer in her 8th week of pregnancy. Her and her husband had been trying for a baby for 10 years. Was advised to terminate the pregnancy to pursue aggressive treatment. Of course she refused. Was induced at 32 weeks and her entire abdomen was overcome with malignant tumors by this time. The cancer had also spread to her lungs and bones. Baby was born, sent to NICU, and mom was sent home on hospice. She died 3 weeks later. Baby is doing fine today and just turned a year old. Hospice nurse here. My assignment was a 13-hour shift with a 10-year-old patient suffering from brain cancer. One-on-one care in his home. He was unresponsive, but still breathing, when I arrived. Basically he was gone, but his body hadn't figured that out yet. Tiny little guy in a big hospital bed. His mom, lying in the bed beside him. His dad was on his other side holding his hand. Grandparents were in the adjoining living room with the patient's 6-year-old sister. Getting through that shift took all the mental and emotional strength I had. He died a few hours after my shift ended. I will gladly deal with blood, vomit, pus, crap, whatever rather than go through something like that ever again. You've been visited by the all-seeing doggers. Good visions will come to you, but only if you comment "Watch me puppers." If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.